Now, Ghana's National Health Insurance Scheme was established in 2003 through the leadership of President John Agyekum Kufuor to help deal with the problem of cash and carry within the health systems of the country. Now, it was welcome news for many Ghanaians who had either lost family members or resorted to self-medication for ailments requiring expert care. The introduction of the NHIS brought hope, with many expecting to access quality health care regardless of whether they had cash readily available or not. But yesterday, the man responsible for making this scheme work, the health minister, delivered the most damning verdict on the NHIS. We'll be learning more. A new law, Act 852, which replaced Act 650 in October 2012, to consolidate the NHIS, remove administrative bottlenecks, introduce transparency, reduce opportunities for corruption and gaming of the system, and make for more effective governance of the scheme. So how exactly did we end up where we are? Let's hear from some users of the scheme who shared their experiences.
I've been coming to the hospital at Kolebu, and the National Health Insurance, only the thing that it covers with is the visitation, only the visitation. I have to pay for the lab and the scan and those things. That's the only thing the National Health Insurance does.
I have NHIS, and when I go to hospital, it only covers my payment of the hospital bill. So the NHIS, it doesn't cover my medicine.
Bedro biana miton insurance nin cover. Intimitia, mituya, everything. Yetuya, it's insurance crown cover. Baby,
I have a national insurance card. The other time I was here and I went radiotherapy. The amount I paid, in fact, I don't know where stand the insurance card. So I don't know if it is working or not.
Right, so Kofi Asante joins us with all the data you could possibly want on this issue. Rather strange development, the minister himself admitting that things are not the way they should be. How do the numbers look?
Well, so we've been looking at the NHIS, the enrollment so far, right from 2017 to 2023. And then you could see an upward, adjustment in terms of the trend. But one worrying thing is that we are talking about finance. It's one of the reasons why the NHIS is under this kind of, stress it is at the moment. But day in and day out, we have this levy that we pay, which is the National Health Insurance Levy. Yeah, and then we check the data, we realize that on average, we get about, $3 billion every year. On your screens right now is the total NHIS enrollment in millions. So just look at what we have in 2017, where we had 10.6 million of Ghanaians enrolled on the NHIS. And then in 2022, as of September, the number actually increased from 10.6 to 15.2. And in 2023, we are hoping to end the year with an enrollment hovering around 20.3 million. So we are 31 million people, but we are expecting that we have about 20.3 million people on the scheme. But the question you have to ask yourself is, you have this total number of people on the scheme, but do they really get the kind of support they need when the state is raking in, or how do you call it, getting about 3 billion cedis every year from the NHIL, levy? You ask yourself, do people really get the kind of support they want? One other, trend that we saw that was very interesting was the fact that if you look at the coverage, the NHIS coverage right from 2013, it was on an upward trajectory up until, somewhere around 2015 that it started dropping. And you can see that U shape on your screen where it dropped from 2015 down to 2018. Then right after 2018, we saw the coverage increasing from somewhere around 36% to what we have the projected. We are projecting that it will cover more than 50% of the population. So on your screen right now, is the NHIS coverage. That's the percentage of the population actually on this scheme that we're talking about.
So it's on the incline at the moment. It's
at the
going
moment,
up.
yeah.
Yet
Yeah.
the funds don't appear to be.
So if you can show the
commensurate.
graph on the funds, that would be an interesting one to look at. If you can find, the exactly. So if you look at the NHIS expected revenue in $1 billion, this was what I was talking about. And so in 2017, we were actually able to raise about $1.4 billion from the
Ghana
scheme.
cedis.
Exactly, sorry, Ghana cedis. And it's been on an upward trajectory. So we get all these money. So now let's do some small calculation here. So 2017 to 20, if I should do a rough estimate, and that should be more than some $15 billion Ghana cedis that we are talking
from
about.
2017
to 2023. So on average, we get close to 3 billion Ghana cedis from this scheme. But we ask ourselves, are we really getting the benefits that we set out that this levy should do? Maybe because of the deficit we have, where almost everything we raise is being used to service debt. We are a country where we use about 40% of our total revenue to settle debt. So you ask yourself, if you pay workers compensation, which is around 30 billion or 36 billion Ghana cedis, you service your debts around 32 billion Ghana cedis, and you add these two, you are actually truncating about 50 or 60% of your revenue. How much is there left to do roads, to support people who are on the scheme, and then also to do other things? So it's a very worrying situation, Kojo.
No doubt about it, especially bearing in mind that a specific amount is collected from the taxes we pay for this purpose. Thank you so much, Kofi, for giving us quite a broad picture of what's going on there. Now let's get some detail of the exact comments made by the finance minister, by the health minister. Ohiming Teria is with our health desk. He sat through the senior managers meeting in Kumasi. He joins us right now via Zoom. Ohiming, you sat there, you heard the finance minister declare the state of our NHIS. Now, how exactly are the health professionals there taking the information given by the health minister?
Thank you, Kojo. I think this is not new to the health professionals who gathered at the Lancaster Hotel for the first ever 2023 senior managers meeting for Ghana Health Service. For them, it was just perhaps a continuation of the discussion on the state of NHIS in the country. Earlier than that, earlier before the minister mounted that podium, there were concerns from representatives of CHAG, and their issue was that NHIS, if you look at the tariff regime, it did not take into consideration how utilities, cost of utility could be factored into that, and that facilities were bedeviled with high cost of utility tariffs, and many of the facilities across the country were being disconnected. Then there was a rebuttal from the head of monitoring and evaluation from NHIS, Dr. Asensobwadi, who said, if you look at how the NHIS tariffs are structured, there's indication or there's a bit of the tariffs that takes care of utility bills and all that. So he asked all the facilities to pay attention so that they will be able to raise enough funds to cater for their utility cost. And then when the health minister, perhaps was the last speaker to speak at yesterday's event, he is the only person to have opened the lid on that can of worms, hitting the issues as they were. He didn't mince words. At the point I could see that he was very distraught, talking about the fact that people had to queue in his house and his office, and he having had to sometimes turn some of the people away because he's spoken to some of them beneficiaries, and the response is that some of them were being asked to pay for services that are supposed to have been covered under the health insurance scheme. For instance, he mentioned cesarean section, which should have been covered by NHIS, but according to him, in some instances, it costs about 1,000 Ghana cedis. So the poor beneficiaries are the ones who are being asked to pay. So in his own words, he described this situation as extortion from the health facilities. And so he asked Ghana Health Service, especially the top managers who had gathered at that meeting, to fashion out strategies to deal with this issue. So it's something that the minister was very, very passionate about. But from the health professionals, all of them sat, quietly and listened to the minister. And there are instances where some of them laughed, especially when the minister said he and other colleague MPs regret being MPs because of the burden, associated with the work. People have to queue in your homes and offices asking for monies and funds to pay for medical bills and all that. So for them, few of them that I spoke to are aware of the issues at NHI, just that they've been managing the situation for now.
Now, the president appointed Kwekwa Agyeman-Manu as health minister and explained to the nation that his choice was because of Mr. Agyeman-Manu's finance background, which he said would help manage the situation at NHIA. That was the specific reason why the president chose him. Did he give any indication of a solution that he had for the current ailment?
For me, it was just a situation that the minister was aware that this is really what was happening at NHIA, and this was really what was happening to the scheme. So he made reference to the top managers, because the meeting, I must say, is a gathering of all the stakeholders in health. When you talk of health in Ghana, we have the health minister, some directors and some officials from the ministry. There are some officials from World Health Organization, and a lot of organizations, mention CHAG, mention National Ambulance Service, and all the big men who matters when it comes to healthcare, policy, and this enactment. So for him, he referred the matter to them that we are all aware of this situation. So what can we do? What can be done to save the situation so we don't overburden the poor subscribers or the poor healthcare seekers, people who go to the health facilities in search of healthcare. So for the minister, he didn't talk about what he was going to do, but rather said he has trust and confidence in all the people who have gathered. So he brought the matter on the table for everybody to have a bite of it. So for the minister, I think perhaps maybe after this interview, we will want to speak to him and see how he intends to solve this problem. But as far as that meeting was concerned, the minister asked all the stakeholders to judge or to bring ideas so that they could bring some finality to the issue of extortion, must say, in inverted comma, at the National Health Insurance Authority.
Thanks for that, Ohiming. Let's now bring in Dr. Thomas Anaba. He's Executive Director of the Africa Center for Health Policy, Research and Analysis. He joins us via phone. Dr. Anaba, thank you for your time.
Thank you. Good afternoon, and afternoon to your cherished listeners.
Good afternoon. Now, you used to be the medical director at Ridge Hospital, Greater Accra Regional Hospital. How exactly did we get to this point where patients now have to pay for basic health care, which should be covered by a health insurance system that we're all paying for?
Thank you very much for the opportunity to contribute to this topic. I think, in summary, it is part of the gross mismanagement and the inappropriate disbursement of government funds to entities that are supposed to get pushing money to wrong places and making the health insurance to suffer. Remember, this minister was appointed with the backdrop that he's a good accountant, he's worked at NHIS before, and that he was coming to resuscitate the national health insurance from the debt that it was engulfed with. He came and promised in April 2017 that by August, they will clear all the debt owed service providers, and we all clapped for him. Little did we know that he was rather going to mess up the health insurance system in the country. The first thing he did was to appoint more deputy directors to the authority, drawing salaries and other things. The other thing was to apportion some of the NHIS money to pay nursing training allowance that some of us kicked against. You don't take money for patients, services provided to patients, to pay nurses in schools. They took some of the money to give to parliamentarians to act as PROs for the National Health Insurance. We kicked against it, but everybody was quiet. It continues. The most important thing that has made the NHIS not to be functioning well is the refusal of the finance minister to transfer money collected in the name of National Health Insurance as taxes to the authority. The law states that the minister must transfer money collected or all taxes collected in the name of NHIS to them 1 month after that and report to the parliament every 6 months about how the money has been spent and then the rest. Since this minister came and the finance minister came to power, this has never happened in Ghana. We have called several times for this to be done, but it all falls on deaf ears. Characteristic of this government not paying heed to any call from CSOs, concerned Ghanaians, and listening to the plight of Ghanaians. So we keep mounting a lot of pressure on hospitals to run well. They've managed to appoint party surrogates to occupy virtually all positions in NHIS, as well as directors in hospitals. The few that rise to talk about it are transferred immediately. So I think all is simply because they are really not interested in money that goes into the authority. They are interested in collecting all the levies and keeping it government to misappropriate it, and no one is holding them responsible. They have called for this minister to come to parliament to answer questions about NHIS several times. He has refused to appear. No one can subpoena him. He does what he wants. I think it is the powers that made him the minister that is causing this minister to behave like this.
Let me ask you this. I mean, you're right. The president did say that he had brought him on as health minister because of his accounting background for the purpose of managing the NHIA. But the current state of the NHIA, does that not suggest that the problems at NHIA are not accounting problems? We've heard about extortion and other things that are also digging a very deep hole in the finances of the authority.
It can be. It can be because our vice president and government is saying they'll be able to digitalize virtually everything. They have bought new software for the NHIA, new claims, electronic claims. How can people infiltrate in it? Don't they have security measures? It shouldn't be a matter of extortion. If there's extortion, they know those who are extorting. What the extortion that I don't want and we don't like is patients having to pay for services that are covered by the NHIS. Simply because we all pay that tax. Even the patient pays that tax. So why should we be paying for services that we have already paid for it? You know, from the Parliamentary Select Committee on Health, Akanbo has told us that in 2020, government made 2021, government made over 5 billion Ghana cedis and transferred less than 1 billion to NHIS, 700 and something thousand. The rest of the money, where did it go? Besides that money in 2020, health alone, because of coronavirus, had donations over 20-something billion. The government needed only 12 billion to solve coronavirus. Where is that excess money? We don't know where it went. So it's not a matter of extortion in NHIS. It is that there is mismanagement, and they know it. It is once you appoint cronies, once you appoint party cronies into positions, no one can raise a finger against the other. And once MPs in Parliament will say, yeah, to a government, and not hold them responsible for the life of their constituents, this will happen. Or else, I think the only thing that Ghanaians should benefit from a government that must be given to them is health and education. But we are toying with it. We are collecting huge taxes for health and education, and the money is not turned out to the right channels to solve our health problems. So patients are forced to buy gloves for their surgical operations. Patients are forced to buy syringes for their injections. Patients are forced to even pay doctors top up to be able to get a good consultation. I think the whole problem is government lackadaisical attitude towards the health sector. If it is that we're not paying health insurance, that is different. But you are charging us for all this. You go to the port and clear anything, and you see the amount of money they collect as taxes for NHIS. You go to a restaurant and eat in Osu, and you see the taxes that come with it for NHIS. You go to any shop in Accra or anywhere, and you see the taxes that are being taken for NHIS. At the end, the money is not given to the authority. Why is government misappropriating the funds? What is it using the money for? Because everywhere we are crying for lack of funds. Where is the money going? It is the scheme of this government. It is the scheme of this government to some of it to misappropriate funds and do whatever it wants because they feel they are in power and no one can hold them on. We've seen what has happened to the health minister even when he bought vaccines that were non-existent. He was at the end exonerated. Exonerated for buying vaccines that were non-existent, sole contracts issued by only a minister without authorities' approval, public procurement authorities' approval. So it is what I've just said. The president looks aloof.
Now, let me ask you this, Dr. Anaba. I mean, let's be fair. It is not only under this administration that we have seen this indebtedness of the NHIA to its suppliers. It's a historical thing. We've had it in previous governments. There has always been a difficulty with government collecting the tax but not paying out the right amount to the scheme. It's been happening for many years now. So clearly the problem is not just this administration, is it?
It is not, but remember, those two previous governments, before time, it was just beginning. Atamils came, tried to straighten it. Hama came and left. That is what we call the learning curve. We passed 10 years of the NHIS. More than that. If you take the first 10 years, we have problems and we are rectified. We've got in smart software to manage it. With all this, we are experiencing the worst form of NHIS delivery in the history of Ghana.
So now it's no longer a learning curve?
No, we passed the learning curve. We should have been better now. We should have been flying now. It should have been that we should be adding certain services, and it should be that you can even take your card and go to anywhere and your history would appear in any hospital. It should have been very easy now. But they've rather made it worse. We are going backwards. The first two regimes were learning curves because before he instituted it just not long ago that he left. The Mahama and then Samuel came in, trying to help rectify it. Why did this government come promising to do it? But we are rather seeing a degeneration of the delivery of funds to the authority. And we know that we are getting huge, so many billions on behalf of National Health Insurance. But at the end of the year, I can tell you for the past 4 years, we've not spent 1 billion every year on NHIS. Meanwhile, we collect billions.
So, Dr. Anaba, let me ask you, what would be the solution? What should be the first step taken to start to rectify this age-old problem?
Like many other countries, advanced countries, we should scrap the board and put trustees into it, like they have in UK, US, and in the rest.
Why would that be an advantage?
It will be an advantage because trustees are working to make sure the system works well. It is not; they are not appointed by government. They are appointed by different organizations. How do they call it? The workers' union will have a rep. The doctors will have a rep. The chiefs can have a rep. Everybody will have a rep, and they must work in the interest of the people. But now the appointment is done by the government, and they're done to the tune of the government. If there were trustees that the money must come to the NHIS, they will hold government responsible. Because if the labor union members don't fight for the money to come to it, they go back, labor organizations will ask them. If it is doctors, they will ask them. If it is the chiefs, they will ask for the money to move. And they will ask for the money to be used judiciously. I think we should go the British way, like the American way, and appoint trustees to the NHIS. Those who work and bring in money, those who will see to the judicious use of the money and the proper implementation, application of the funds. Not using the funds to pay feeding what allowance, nursing training allowance, paying parliamentarians as CROs. Is that their work? That's not their job.
All right. Now, I want you to stay with us. Ohiming is also joining us via Zoom. Let us now watch the health minister himself explaining the extent of the problem. Then we'll come back for final thoughts from Dr. Anaba and from our correspondent, Ohiming Teria.
I have health insurance cards. My kids have them. But we don't use them. Because where we live and where we go, I pay when I go to Rich Hospital. I pay when I go to UGMC. I don't even present my health insurance card.
According to the health minister, some subscribers of the NHIS have lost confidence in the scheme, but assume the NHIS has collapsed. Mr. Ajimamenu says he has come across situations where NHIS beneficiaries are forced to cough 1,000 Ghana cedis for a cesarean service covered by the scheme. Some practices, he says, do not only affect the poor, but also drive away people like him to turn to cash payment at some health facilities for care. In some instances, NHIS subscribers who are unable to pay the exorbitant bills charged by the service providers turn to their parliamentarians for help, a situation Mr. Ajimamenu described as unfortunate.
From the end user point of view, it looks like health insurance is not working in our country at the moment. I'm a patient and I know what it is. And I interact with a lot of people, not only my constituency, not only my region, but elsewhere. Health insurance are treated in almost all our facilities. To the extent that even CS, some are paying more than 1,000 cedis from their pockets in quite a number of our facilities now, when that is on the health insurance benefit package list. So why should I use that harsh word, extort from the poor patients?
The health minister, who spoke at the Ghana Health Service Senior Managers meeting for 2023, also spoke against the high cost of medical implants and other logistics. He called on the senior managers to find possible cheaper means of access to healthcare delivery while adopting mechanisms to support healthcare delivery.
There are certain disciplines that we cannot even go. As I stand here, I have somebody with an estimate for a orthopedic intervention for 53,000 Ghana cedi. Yesterday in the night, by 8 o'clock, that lady was sitting in my house. The previous time, she chased me in my office, MP's office in Doma. I was just getting into my car. She showed me the cost estimate. I said, Madam, I cannot afford. Only on you, 53,000. What about the rest who have queued looking for support from the MP? Then she asked me, Entimingu, what do we do about this? So we need strategies, not from the DG alone, not from anybody in the ministry headquarters, but how we can get cheaper implants to supply for people to use so that they get out of these challenges.
Meanwhile, Chief Executive of NHIS, Dr. Bernard Okoboy, talks about efforts to improve claim submission processes at the NHIS. His address was delivered by the Head of Research, Policy and Monitoring and Evaluation, Dr. Francis Asensobwedi.
Going forward, if claims delay beyond a certain period, which is about 3 months, we may find it difficult to accept such claims. And that is the reason why we are digitalizing the claim submission processes.
From Kumasi, for Joy News, Ohiming Teria reporting.
Right. Now, Ohiming, that was your report. You were there. You've talked to us about the response and reactions of the stakeholders. What is the situation on the ground, apart from the health minister's own anecdote about people's real life suffering and women asking whether they should die because they cannot afford medication, which should have been covered by their health insurance? What is the situation on the ground, the end user? How are these numbers and statistics affecting them?
Yes, Kojo, many people have several stories. If you speak to people on the streets of Kumasi, for instance, they have stories that they want to share with you as far as their association with NHIS is concerned. The issue is that, yes, they have come to assume that that is the status quo. So who do you complain to? How do you complain? So let's accept it and then move forward. And so many people who hitherto had registered for the NHIS, they feel so reluctant to access services under the scheme. So they prefer to go to facilities where they will be charged, they will pay, and then go away. There are also complaints about even when you go with a card, you've paid, you are up to date, your membership is up to date. You go, they tell you, wait, somebody will come and then perhaps impute your information. It takes you several minutes or sometimes hours. And so if you look at, if you had paid for the services and then if you go there under the National Health Insurance Scheme, the delay associated with you going with the card, a lot of people prefer to go to the facilities where they will pay. Even if they will go to the same facility that is covered under health insurance, they want to go and then pay. So in some other words, you can say that, yes, cash and carry has not been eradicated. It's still being run, alongside the health insurance scheme or the health insurance, system. So it's an issue that has to be dealt with. But for Mr. Kwaku Agyeman-Manu, he himself has tried and tested, the scheme, and he's able to tell the story from the point of being an end user. And that is how come he said he's a registered, a member of the health insurance scheme, but he and his family don't use the card because perhaps he explained that they are well to do. They can afford services at the Rage Hospital, at the University of Ghana Medical Center. But what about the poor patient, the poor Ghanaian who is unable to afford the services or the cost of healthcare outside the health insurance? So he wants everybody, stakeholders, to come together, at a round table to discuss possible means of eradicating the cash and carry system that appears to be taking over the health insurance scheme. Kojo.
Thank you for that, Ohiming. Dr. Anaba, I'm going to take final thoughts from you on this. You have been a healthcare practitioner for a very long time. You were even before the National Health Insurance Scheme was introduced. Tell us in stark and clear terms, if nothing is done and this problem persists, what will healthcare look like? What are some of the images from the early 2000s that we will start seeing re-emerging in our hospitals? What will it look like to be a Ghanaian with healthcare needs and no healthcare insurance?
It will just be like, if you don't have food, you don't go to money, you don't go to a restaurant. So you stay with your hunger. So if you don't have money, you don't go to a hospital. But that would not be the only thing. People would resort to various means and orthodox means of seeking healthcare. Morbidity would increase, mortality would increase. But I don't think it should go that way. I think we Ghanaians must mobilize ourselves. We cannot be contributing money for our health, and the government is refusing to use the money to take care of our health. I think that we must rise against the odds and push the government. If at all you spend any money else at the right place, for the health sector, that is where our lives depend. The minister painted a vivid picture, and I'm happy he painted it. But I'm surprised he didn't say he has failed on the assignment the president gave to him. He has failed to say he's resigning. This is immoral. In a civilized country, for a minister who was appointed to strengthen the NHIS, after saying this, that he himself has experienced it, he would conclude by tendering in his resignation letter. But we know this minister. Even when he was caught corrupt, he didn't resign. How much more when he's failing to correct his subordinates? So I know he will resign. But it is left unto we Ghanaians to rise up, to push the government, to make sure the money we are contributing for health is used for health. Because we are making billions of Ghana cedis for health, and we spend less than $1 billion in a year on health. So it is because probably we are not approaching the government in a very, very serious way. Senior leaders, church leaders, religious leaders, chiefs should rise up and tell government, at least once in their lifetime in their government, they should do the needful by spending health money in health. Or else they are just going to subject people like that woman who said, should I go and die? To go and die.
Indeed.
And which shouldn't be the case.
Dr. Anaba, I want to thank you for your time. Now, Ohiming, finally, after hearing the health minister, you obviously followed the story and you've got a response from the managers of the NHIA itself. Am I right?
Yesterday's meeting, portion of it was open to the media. So I'm hoping to get some response from the officials of NHIA. So I'm still seen around. At this moment, it's a closed-door meeting because this is where the top managers meet to digest and also look at the way forward. So I've been promised of possibly meeting some of the top officials here. So hopefully we'll get some response from NHIA.
All right. Thank you so much for your time and for pursuing this story for us. Ohiming Tewia from the Joy News Health Desk.